Yeah,
Yeah.
yeah.
You're audible.
So, welcome, Shushwagatam, Namaskar, everybody. I am President Rotarian Shabarna Kumar De, the host club president. I can remember one sloka before the Durga Puja when I was in Ramakrishna Mission. So it was like that. Oigiri Nandini, Nandito Medini, Vishwa Vinodini, Nandanute, Girivara Vindo, Shirodhini Bhashini, Vishnu Bilashini, Jisnanute. Just before Durga Puja, Devi Paksha started. It's the fourth night or Chaturthi. So I feel what can be a better day for this kind of webinar dedicated to the Kunna Jaya Janoni. It's a perfect coincidence. And I hope everybody of you who have already joined, who are going to join, you will get enriched from Professor Dr. P. Raghuram's speech. You will be further knowledgeable and have a healthy life. Again, I can remember one very good Upanishad shloka, that is, Om Sharve Bhavantu Shukhinaha, Sarve Shantu Niramaya, Sarve Bhadrani Pashyantu, Ma Kaschit Dukh Bhage Bhave. Om Shanti, Shanti, Shanti. It means, Om, it means, may all we be happy. May all we be free from illness. May all we see what is auspicious, and may no one suffer. Let there be peace amongst ourselves. Let there be peace in the nature. Let there be peace divinely. And with this, let us start, or let us go for the second step of the seminar. And I hope our Women Empowerment Chair, past President Rotarian Shamta Golche, is ready to deliver her valuable words. Shamta ji, ready?
Yeah, sure. Yeah.
Please
Actually,
carry on.
such a beautiful shloka is starting this program with such a beautiful shlok means a lot for everyone of us, because yes, we want a disease-free life. Everyone want this thing. And if we are aware of certain things beforehand, nothing beautiful than that. Ladies and gentlemen, good evening. Myself, Rotarian Samta, Women Empowerment Chair for District 3240 this year. So, good evening, everyone.
Very good evening.
Today, I would really like to thank Subarna Da for taking this initiative on behalf of our district and making it possible to make us aware about this breast health. There are so many myths regarding this. So when Dr. is here, Raghuramji is here, we will definitely come to know many things about this. And thank you to Rotary Club of Vardhaman South, who has taken part for this. Please, Shubhanada, convey our thanks from the district to your club for taking this, making this possible.
Sure.
We all women are emblem of strength, resilience, and unity in our guest of empowered women, and create a better and healthier future for all. Breast cancer affects women globally, transcending boundaries and backgrounds. It is a battle that many of us, our loved ones, may face. So our mission to equip women with knowledge, support, and resources to defeat and prevent this compound disease. तो हम कई बार समाज में क्या होता है कि इन बातों को अनदेखा कर देते हैं और इन सब बातों को करने में हिचकिचाते हैं, मगर ये बहुत ही ज्यादा अनिवार्य है और मैं तहे दिल से वर्धमान साउथ को शुक्रिया अदा करना चाहूंगी ये चर्चा सामने लाने के लिए. So let us remember that awareness is not regarding gender. So as a quiet handful of male, female, everyone is here. ज्ञान जितना मिले उतना कम है और हमेशा प्रिवेंशन इज बेटर देन क्योर ये हम सुनते आ रहे हैं. तो यदि हम जितना ज्ञान आज ले पाए, जितनी चीजें हम सीख पाए, वो डेफिनेटली हमारे बहुत ही फायदे का सौदा रहेगा. Let us remember that this is an impact us all together as empowered women of Rotary will make a difference. So let's join hands with, please join hands with us in this crucial endeavor for tough awareness and unity. We can save lives, promote health, and empower women to take charge of their well-being. So I hope you all are ready to take the knowledge from Raghuramji. He'll be very soon joining us. And once again, thank you and welcome you all. Thank you from my part.
Thank you, Samtaji. It was a encouraging, inspiring delivery. And now let me invite our dynamic district governor, Rotarian Nilesh Kumar Agarwal. Sir, are you ready, sir? Nilesh ji?
I am always ready.
Thank you so much. Sir, please carry forward.
Good evening, all. It's nice to see the Matra Shakti here, and with that wonderful quotes of the President Bardwan South Rotarian Sabarno Kumar Deji, and the Chairperson Women Empowerment Samta Golcha ji, Shubhankar ji, Disease Prevention Chair Chandrajit Kundu ji, DRR Parna, I am seeing, DS Admin Danny, or Assistant Governors, Presidents, all invited members and participants. When I was requested to make this program as a district webinar program, and when Shubhankar da rang me that I have visited and I had a very good speaker on breast health, I immediately, without taking much time, given the acceptance that yes, we can make this as a district webinar. And I am so glad that today till now we have 28 participants and more to join. I was going through the profile of Dr. Raghuramanji, and I would like to tell you the achievements and the profile speaks of itself. उनको एक पदवी मिली हुई है OBE. It's very rare to get, and OBE means Officer of the Most Excellent Order of the British Empire. He was earlier out of India. अभी आपको जब उनकी प्रोफाइल बताई जाएगी. And when we came back to India, उन्होंने हमारे फॉर्मर प्रेसिडेंट अब्दुल कलाम जी का एक फ्रेज लिया कि हम जो अमेरिकन्स और ब्रिटिशर्स अपने देश के लिए कर रहे हैं, क्या हम वो चीज अपने देश के लिए नहीं कर सकते क्या? So that phrase, he came back to India and then starting serving here. And he is a profound doctor in breast health, breast cancer. So today we are having this webinar on ABC of breast health, a crucial topic that affects the lives of millions of women around the world. Breast health की जब हम बात करते हैं, it's not a matter of concern of any health related issue, but breast health is not a subject to be taken lightly. It's a matter of empowerment, awareness, and a care for our loved ones and ourselves. By educating ourselves and spreading the word about breast health, we can make a significant difference in the lives of women and individuals of all genders. So I'd like to congratulate and wish all the very best this district webinar on breast health. And I hope when the speakers arrive and when you start deliberating, you will be getting knowledge on breast health. But मेरा एक मानना है कि जो knowledge हमें मिलता है वो सिर्फ हमें अपनों तक नहीं रखना चाहिए. अगर वो knowledge हम अपनों तक रखेंगे तो वो फायदा नहीं होगा आज ये वेबिनार करके. बट अगर वो हम नॉलेज को स्प्रेड करेंगे, हमारे आसपास में हमारे रोटेरियंस के स्पाउस है, उनकी बेटियां हैं, हमारे दोस्त हैं, हमारे क्लब के और मेंबर्स हैं, कि जितना ज्यादा हम इस चीज को स्प्रेड कर सके, अवेयर कर सकें, ताकि पहली ही स्टेज में हमें अगर चीजें पता लग जाए तो ये बहुत आगे तक न जाए और हम इसको यहीं कंट्रोल कर सके. सो दिस इज जस्ट ए बिगनिंग एंड आई होप इन द डेज टू कम, अगर ये सेमिनार हमें लगा कि इट्स वेरी यूजफुल और हम कुछ और अच्छा कर सकते हैं, तो हो सकता है कि फिजिकली भी हम उनको इनवाइट करें कि वो हमारे डिस्ट्रिक्ट में आए कोई फोरम में, ताकि हम उनका और ज्यादा से ज्यादा लाभ ले सके. सो दिस इज ऑल फॉर टुडे आई वांट टू से. एंड टुडे वी आर आल्सो हैविंग द zonal additional ambassador of 3291 and 3240 Rotarian Dr. Pallavi Maji in this program. I acknowledge her presence and I acknowledge the presence of all the presidents, secretaries and all. And I hope this webinar will be a great success in terms of knowledge and then spreading the knowledge, as I already said, to near and dear ones. Thank you for inviting me to this program and giving the opportunity to address you all. Wish you all the best. Thank you.
Thank you. Thank you so much. It's so much on time that you were supposed to speak up to 6:50 and it's just 6:50. Thank you so much.
Thank you.
And it was enriching, and you rightly said that the benefits should be extended to the beloved family members, to the friends, to the relatives. Then only knowledge can spread and we can have a better life. Thank you so much, Nilesh. And now the purpose of the seminar, introduction of today's speaker, it's going to be done by our very dear and near past President Rotarian, Dr. Shubhranko Chakraborty. So let us all invite Dr. Shubhranko Chakraborty to please start the purpose of the meeting as well as to introduce the speaker afterwards. Please, Shubhranko.
Good evening, everybody. While I go online to introduce the speaker of the evening, well, am I audible?
Yes, sir.
Okay. While I go online to introduce the speaker of the evening, I must express my joy of being a key to the happening of this webinar. We had a meeting in Hyderabad. I met Dr. Raghuram there. And when I was going through his achievements in the field of breast cancer awareness, and it suddenly struck me that October is the month of women empowerment, not only from, I think, rather from the Government of India side also. So I thought this would be a nice time to host a webinar about breast health care. And I express my deep gratitude to Dr. Raghuram Pilari Satti for accepting my request to address us, and to the district governor for making it a district event on one single request. Well, about purpose of today's seminar, when we talk of women empowerment, we often come across a sarcastic question. Do our women lack in strength to need further empowerment? My basic take here is acknowledging the difference between strength and power. Our women are strong enough from time immemorial, strong enough to endure the rough realities of life silently. The purpose of empowerment is to introduce them to the power of action, the power to react, take optimum steps to rise to the occasion when challenged. Our women have been strong enough to carry a stage 4 fun-getting ulcerated putrid breast cancer under her clothes. Now is the time to empower them with the awareness to act, seek help early, and get rid of the menace. About the speaker, Dr. P. Raghuram, or Raghuram Pilari Setti, as his family name comes along, did his MBBS in 1991, MS in 1995, and went on to get a fellowship of the Royal Colleges of Edinburgh, Glasgow, and Ireland, all in 1997. He is a young achiever. As the laurels in his bag testify, well, listen carefully. He has been the youngest recipient of international gold medal from the Royal College of Edinburgh. What is this? When people sit for the FRCS exam for the Royal College of Surgeons of Edinburgh, and this young man, he stood first among all the candidates internationally. That's a great achievement. He has been one of the youngest surgeons of Indian origin to receive the OBE, that is Officer of the Most Excellent Order of the British Empire, from the Queen of England in 2021. The OBE is an honor only next to knighthood, and he was conferred it in recognition of his services towards improving breast cancer care and surgical education in India and towards developing India-UK relations. He has been the youngest surgeon to deliver a Cornell Pandalai oration. A Cornell Pandalai oration is one of the most respected and the most respected oration that is held by the Association of Surgeons of India. And this is usually given to a very learned senior professor who had been a teacher of teachers. It is very fascinating to note that Dr. Raghuram, in this young age, has been invited to deliver a Cornell Pandalai oration. That was in 2018, if I am not very wrong. He is also one of the youngest surgeons to have been confirmed the Dr. B.C. Roy National Award by the President of India in 2016. 1 year before that, he was awarded Padma Shri, that is in 2015. But achievements apart, the most significant achievement of this man lies in his endeavor to revolutionize the breast cancer care in India through innovative measures. He started with a purpose-built comprehensive breast health care in India, breast health center, and a charitable foundation in Telangana to raise breast cancer awareness among the rural people. This program was later adopted by the Government of India's National Health Mission, and he is now an invitee to the National Health Mission body. Inspired by the Prime Minister's Digital India dream, he developed the world's first breast health mobile phone app, making women aware about having access to early detection and early intervention. I am sure the audience today will come to learn of this new aid to help breast self-examination. He is also involved in philanthropy on a personal level, adapting a village, Ibrahimpur, in Telangana state, and providing it with life-changing equipments and facilities. He had been a Rotarian in some part of his life, though he is presently outside our fold. In recognition of his outstanding academic track record, innovative initiatives in breast health care, and life-transforming philanthropy in his adopted village, he was conferred the prestigious Padma Shri Award by the President of India in 2015. So, to invite a person to talk on breast cancer or breast health as a whole, I was lucky enough to find the best person in the country right now today who would address the seminar in a while. We welcome you from the bottoms of our heart, Dr. Raghuram. And now the audience is all yours.
Thanks very much. May I share the screen, please?
Sir, I on behalf of District 3240 as the District Governor, accord a warm welcome to you all in this district webinar on breast health, sir. I hope with your immense knowledge, our participant will enrich their knowledge on breast health and spread the awareness amongst the Rotarians and others near and dear ones in our district. Thank you for joining us, sir.
Thank you. It says the host disabled participant screen sharing. So,
Okay, you need to make a co-host. Danny is
Savarna,
there?
can you make?
Yes, I'm doing it. I'm
Dr.
doing it.
Ashok?
Just give me
Okay,
2
Danny.
seconds.
Okay, he's doing, please.
Yeah,
It
it's
will
done.
be done in a while. Yeah.
okay. So, good evening, and District Governor Nilesh Agarwal, Rotarian Nilesh Agarwal, and the Rotary Club of Burdwan South, headed by Rotarian Sabarna De, and to all the members, so all the Rotarians from all across the various Rotarian clubs, namaskaram and greetings from Hyderabad. I, in fact, consider this as a unique and a distinct opportunity to be able to address the elite Rotarians this evening on a subject which is very close to my heart. So as all of you are aware, October is world over considered to be an International Breast Cancer Awareness Month. And the aim of this month is to create the awareness about the importance of early detection and also equally spread the message of hope, courage, and survival in the fight against breast cancer. Because there are many in the country who are fighting the disease, and there are many families who are supporting these breast cancer conquerors, I would call them, who are fighting the invisible cancer. And so we celebrate this month, commemorate this month, in fact, for these reasons which I've just highlighted. So yes, I'm just trying to see how I can the desktop, it says open system preference. There's some problem. It is asking me to, it should not happen. Normally the presentation would come up. Are you able to see the presentation? No?
No, sir.
No, sir.
Okay. So I don't know. I have to see, there's something wrong. I'm very sorry about this. I'm not able to share.
Can we do anything there, Danny?
I'm not sure, not able to.
Can Danny check?
Shall I exit and then come back? May I do that?
Yeah, you can.
Yeah. Please, you can try once, sir. Or you can share the presentation with us. We can also share. We can also share the screen.
Yeah.
But
Is Danny there?
that's
No,
the
you
last.
are already co-host, so I think it should be okay. Otherwise, you can just log in and log out again, and I'll again make you co-host.
Okay, I'm sorry, I don't know why it's never happened like this before. I'll close all the other screens. I don't know whether that will help. Mhm. I'll try again to share. Host, if you can enable me, please.
Yeah, Danny.
Yeah, just give me
Yeah,
1 minute.
sure, sure,
Right.
sure. Please.
Could do it, but there you go.
So many clubs have joined together to attend this session.
Yeah, yes.
That's wonderful.
Sir, in our district, we have a very large geographical area. It covers the entire northeast states,
Okay.
Sikkim, South Bengal, and North Bengal.
Okay.
We have 105 clubs, 3,600 members, sir.
Oh, I see. Okay.
Yeah,
North Bengal as well. Okay.
North
Right.
Bengal and South Bengal. So
Okay.
this is our district 3240. It's very largely geographically covered.
Yeah, I'm now there,
Okay.
but there is something, it says desktop not able to open. I don't know why is that happening. Allow Zoom to share.
Sir, the problem would be at your end.
Yeah, it is at my end. So it is saying allow Zoom to share your screen. Then it's saying open system preferences. This has never happened before. I'm not sure why it is happening this way. The only other option is I have to send the presentation, but it's a big file. So maybe I'll open it here and then speak out. Perhaps that will probably the only, I wish you could see the presentation because that's a very, it would make it more interesting.
Mhm.
But this never happened. It's the first time.
So, or, sir, if you can share the file with us on mail.
But that file, what happens is every sentence has to, I'll be having to say next slide, next slide. It wastes a lot of time because it's not just a slide. Even the sentence, there is a click mark.
Okay.
So I'll just see once more for, if you give me 2 more minutes. Files. Desktop. No, there's something wrong, I think, at my end. So I think I'll just start my presentation, and I think what I'll do is I'm only feeling bad that I'm not able to show the presentation. Okay. So you can see me and hear me, all right?
Yeah.
Okay, right. So I'll start off. First of all, my sincere apologies. I come from Hyderabad, and my story is that I was working in the UK when my mother had breast cancer, which brought me back to India because of two reasons. One is to look after my parents, my mother particularly, because the journey is very difficult. Much as I'm the only child, I, along with my wife, Vaijayanti, who's a fertility specialist, decided to relocate back to India to look after our parents. That's the first reason. The second reason is to serve my motherland, because of the fact that because of lack of awareness and absence of an organized screening program, more than 60% of breast cancers in the country present in the advanced stages. And there's always a fine line between advocacy and screening. And, I'm not here to scare anybody, but it's very important to understand that breast cancer is a big issue. It's a closet issue. It is a topic that is hushed up, and there is certainly an urgent need to break free from this attitude. And therefore, and when I returned back to India in 2007, I had established a foundation, Usha Lakshmi Breast Cancer Foundation. This has my mother's name associated with it. And at 90 years, she's the chairman and the dynamic chairman of this foundation. So the aims of the foundation are to create awareness, to reach out to the community, which is what I'm doing, and to support those who have been through breast cancer. And I'm here to talk about some of the myths backed by evidence-based facts. So the commonest myth that people have when they come, to visit a doctor with a breast health issue is they think it's a cancer. But the fact remains that 9 out of 10 times the breast health issue is not a cancer. But we can't, consider that the lump is benign, although 9 out of 10 are benign. We can't consider that it is benign until the lady undergoes what is called triple assessment. Triple assessment is the doctor talking to the patient and examining the patient. That is clinical breast examination. That is the first component. The second component is a combination of mammogram, which is an X-ray of the breast, and ultrasound scan. And the third component is a biopsy, a core needle biopsy under ultrasound guidance. So if any of you or your relatives goes to a hospital with a breast problem, with a breast lump, if the doctor says we'll do an operation and decide, then you know that you are in the wrong place. Because in this day and age, it is possible to obtain a definitive diagnosis of cancer or otherwise by this triple assessment, which is examination by the doctor, mammogram and ultrasound, and a core needle biopsy. I emphasize the word core needle biopsy because fine needle aspiration, that is called FNAC, which some of you may be familiar with, is not the standard of care because it can miss cancers. So how do we do this triple assessment? This triple assessment is done by a team. It's not just me as a surgeon, but we require a proper team. And the team includes a radiologist and a pathologist. Just like a stethoscope is required for a physician to diagnose conditions, like that, a surgeon practicing breast disease must have a good expertise of breast radiology and breast pathologist, so that a triple assessment can be done very effectively. There has been a study that has been published in the world-renowned British Medical Journal, not now, but 30 years ago, that majority of the times one can obtain a diagnosis with a good history and examination. And that holds good even today, but unfortunately, it is not widely practiced. And we very often come across when we go to hospitals, the doctors hardly spend any time with the patient, and the doctor straight away starts talking rather than listening to the patient. Because when someone comes with breast health issues, particularly breast cancer, as a doctor, one must always remember that you can cure sometimes, you can relieve often, but it is very important to be able to comfort the patient always. And therefore, I consider it duty bound when someone comes to us and we take counseling very seriously. And this is an important component of the triple assessment, which is talking to the patient, taking the history, and then examination. That is the first component. The second component, as I mentioned to you, is breast imaging, which is a combination of mammogram and ultrasound scan. And the third is an ultrasound guided core needle biopsy. And I'm now going to divide my talk into two phases. First is to address issues which are not related to cancer, and then talk about breast cancer. Because, as I mentioned to you, 9 out of 10 breast health issues relate to non-cancer issues. And the commonest complaint that anybody comes to a surgeon with breast health issue is breast pain. This breast pain can be occurring in very young people or in older people. And breast pain, by and large, if somebody comes with breast pain, we can tell that that patient does not have cancer. Because a lot of times people worry, and there's a lot of myths circulating even in social media, that breast pain is a symptom of breast cancer. I will explain what are the symptoms of breast cancer a little later on, but breast pain is not a symptom of breast cancer. So when someone says breast pain, immediately the doctor is relieved that we are not dealing with a cancer. Of course, if there is a large cancer which is occupying the breast, then it may cause discomfort. But by and large, breast pain means it's not a cancer. Breast pain can be cyclical, which occurs before the periods and relieves after the periods. It is thought to occur because of increased sensitivity of the hormone estrogen on the breast tissue. And it can also be non-cyclical after a certain age, beyond menopause. And there is a third component called chest wall pain, which is very often branded as breast pain. All one needs to do is to roll the patient to the side and examine so that the breast falls away from the breast, the central collarbone and the rib cage. And therefore, one can distinguish chest wall pain from breast pain. So whatever the cause of the breast pain is, it is important to do the triple assessment, which I have emphasized many times a little earlier on. And if the triple assessment is all fine, then what is required is, the first thing is not to give any medication. Lot of time doctors prescribe medication for breast pain, which never ever works. It is a placebo and it has not been found to be useful at all. What is required is reassurance through effective counseling and asking the patient to try all the methods to take this breast pain away from our mind, whether it is through meditation, whether it is to reducing the stress levels. And wearing a correct fitting bra sometimes helps, but essentially no treatment is required except good counseling and reassuring the patient that there is no cancer. The second common condition that women present with is a condition called fibroadenoma. It occurs in very young people. It presents with a lump in the breast, which sometimes is referred to as breast mouse, where the lump is freely mobile. And through triple assessment, we do the ultrasound guided core needle biopsy, which confirms that it is a fibroadenoma. And again here, fibroadenoma, unless it is very large, there is no need to remove the lump. It hurts me to see a lot of women with scarred breasts for removal of this benign condition called fibroadenoma, because fibroadenoma is a benign condition. It does not lead to a cancer. And if it is proven to be a fibroadenoma on ultrasound guided core biopsy, then we can reassure the patient, unless this fibroadenoma is 4 centimeters or 5 centimeters, when it is called a giant fibroadenoma, which necessitates removal of that lump. So therefore, fibroadenoma, by and large, again, nothing needs to be done. The third common benign problem that people present with is suddenly they notice a lump in the breast, and on triple assessment, we find that it is a cyst, a breast cyst. A cyst is a fluid-filled collection. It's just like a balloon filled with water. It is a water bag, and it is by and large essentially painless. And again here, nothing needs to be done unless the cyst is very large and it is causing infection. That is the only time we put a needle and aspirate that cyst. But 1% of these cysts, just a word of caution, just 1%, that is out of 100, one of them can be cancerous. And that can be recognized when we do the mammogram and ultrasound, in which case we have to be careful, do a biopsy and treat it as we would treat a cancer. But by and large, a cyst is a benign condition. The fourth common condition that women present with is breast infection, whether when women are lactating or, not lactating as well, they can present with a lump, a painful lump, which is an abscess or an infection. In the days gone by, what we used to do is an incision and drainage of that abscess, which unfortunately happens even today, even in big centers. So what is required is, when someone presents with the breast abscess, you need to be aware that this abscess can be treated without the need for surgery in the large proportion of patients, by way of an ultrasound guided aspiration of this abscess cavity, so that the fluid can be removed, or the abscess pus can be removed, antibiotics can be instituted, and frequently this ultrasound guided aspiration must be done. And in the vast majority, unless the abscess is very large and multiloculated, it is possible to manage this condition also without the need for an operation. So whatever I have said to you so far, including what I am going to say now, the last condition, which is quite interesting, and I wish I could show you these slides. Tuberculosis can also occur in the breast. And very often tuberculosis mimics cancer on mammogram. And many times it is very badly treated because they have multiple ulcers, multiple abscesses, and they have recurrent operations. And what is required is high index of suspicion, an ultrasound guided biopsy through triple assessment, early institution of anti-tuberculous treatment. And it is almost like magic that all the ulcers and all the scars in the breast heal over a period of time when we start giving the anti-tuberculous therapy. So by and large, all the benign conditions of the breast can be managed conservatively, and very rarely do we need to excise or place the knife on the skin, either to get a diagnosis or to excise a lesion. I'm now going to talk about breast cancer. Now, there is a myth that breast cancer occurs only in older women. Although it is true partially, particularly in the Western countries, where breast cancer is more common after the age of 50. But in a country like India, breast cancer, the peak incidence is between 40 to 50 years. Why is that? We still don't know, but perhaps it is because of the life expectancy. Our life expectancy ranges from 65 to 70 years, whereas in the West, it is over 80 years. And therefore, perhaps this stage migration, and we are seeing a lot of breast cancers in young women. For example, when I was working in the UK, I would see maybe 1 or 2 breast cancers in their 30s and 40s in 3 months. But in India, every week, I see women in 30s, 40s, and 50s presenting with breast cancer. So it's very important to recognize that breast cancer presents in younger women. And the second thing which I'd like to say is that breast cancer, there are many men in this audience, and I'm not sure how many of you are aware that men also can get breast cancer. But don't be alarmed because it is rare. It is not even uncommon, it is rare. How rare? If there are 100 people who get breast cancer, 1 out of 100 will be in men and 99 will be in women. So therefore, it is very rare because men also have breast tissue. So any new changes are there, they must also not neglect themselves. Now, do we know what causes breast cancer? We still don't know what causes breast cancer, but we know that there are well-recognized risk factors. The most common risk factors is being a woman and increasing age. The other well-recognized risk factors are if someone has had breast cancer on one side, their chance of getting breast cancer on the other side is higher than a normal, a person who does not have a family, who has not had a cancer. In addition to this, I'll talk about family history a little later. There are a lot of lifestyle factors, some of which are not in our control, like late marriages, not having children, having the first child after the age of, are you able to hear me? Hello?
Yes, sir. We can hear you.
You are perfectly audible.
Right. So,
And it's going good.
good. Okay, I'm sorry. So having the first child after 30, not breastfeeding, and basically these are all factors that cause uninterrupted action of the hormone estrogen for a prolonged period of time on the breast tissue. So any factor that increases this exposure, for example, when someone has a child, there is a different set of hormones into play. And particularly when someone is breastfeeding, prolactin hormone is produced. So there is a block of the hormone estrogen. So when people don't have children and when they don't breastfeed, there is an uninterrupted action of the estrogen on the breast. So their risk is high. It doesn't mean that they will definitely get it, but their risk is slightly high. Now, the important point which I'd like to emphasize also here is obesity, particularly after menopause, when the hormone estrogen is, as you know, is produced by the ovary. And after menopause, we may think that it stops producing. Yes, the ovaries don't function, but the fat cells in the body can start producing estrogen. And therefore, it is very important to keep our weight in control, particularly after menopause, so that we don't give the opportunity for this estrogen to be produced in the fat cells. And the other major risk factor, which occurs in about 5 to 10%, is family history. Now, family history doesn't mean just somebody's mother being diagnosed with breast cancer or grandmother being diagnosed with breast cancer. Just because my mother had breast cancer, it doesn't mean that my children are at an increased risk. Family history means, the significant family history, by the way, means that someone has acquired the mutation in 2 sets of genes called BRCA1 and BRCA2. You must have all heard about Angelina Jolie, and she had a very strong family history of breast cancer. Her mother, grandmother, sister, aunts have had breast cancer, and so she was at a very high risk. That is what I'm talking about. So who is in that category of high risk? High risk means high risk of having this genetic mutation. So if someone's immediate relative, like mother, has had breast cancer under the age of 40, or there is someone in the immediate family who has had breast cancer and ovarian cancer, or in the immediate family, someone has had breast cancer on both sides, or there is an immediate family history of male breast cancer. So when these factors are there, one needs to go for genetic counseling before getting the genetic test. And after the genetic test is done, there are various implications of that test, and therefore it should not be done willy-nilly. In fact, I have written a guest column for the Times of India, which has come in Hyderabad edition, Bhubaneswar edition, and the Patna edition. I will share that after this meeting. You can read about why we are creating a scare about this family history. And so once you read that article, you will understand why it is important not to get this genetic test done just like that, just in case. So I'll share that with you. Now, the other risk factor is birth control pills. Yes, birth control pills in the past used to be a very high risk, but nowadays the risk is low. Although there are a lot of studies which have shown that taking birth control pills over a long period of time can cause breast cancer, the risk is quite low, and the benefits of taking birth control pills in terms of avoiding pregnancy far outweighs the risk of getting breast cancer. And the other common myth is about breast self-examination. Come October, there are a number of social media sites and published literature which tells women to examine themselves once in a month in a particular position, to put their hands up and then basically in the sitting posture and in the lying down posture, etc., etc., etc. I must tell you that this has completely been given up. And this breast self-examination concept has been replaced by what is called breast awareness, where women are encouraged to look and feel throughout the month, whether it is whilst application of cream or whilst having a shower, on a daily basis, to look for any new changes in the breast. So what are the changes that one should be aware of? As I told you, breast pain is not a symptom. So any painless lump in the breast, and any recent indrawing of the nipple, that is retraction of the nipple, any blood-stained discharge from the nipple, or any eczema around the nipple areolar region, or dimpling of the skin overlying the breast. If these things are there, or if there is any lump in the armpit or above the collarbone, these don't mean it doesn't mean it's a cancer, but when these symptoms are there, one must not neglect. So it's important to be breast aware, and that is the concept, breast awareness about these symptoms which I have just mentioned, and also the features that one should be on the lookout for. Now, when you talk about mammography, which is an X-ray of the breast, when we ask women to get a mammogram, the two common reasons why women don't go for a mammogram is, firstly, they think that there is a radiation risk. That is a big myth. The radiation from the mammogram is very, very, very tiny as much as a dental X-ray the radiation is. So therefore, one does not need to be worried. And in this day and age of digital mammography and 3D mammography, the radiation is even less. The second reason why women don't go for a mammogram is because they think it is painful. As I mentioned to you, the digital technology, the 3D technology, the compression is far less. Particularly with a 3D mammogram, you get X-ray or mammogram done in different angles, and the three-dimensional view is created. So therefore, there is absolutely no harm in getting a mammogram done. These are the two common myths, and these myths must be dispelled. The other myth is, women think that wearing underwire bra, because there's a lot of published literature and social media that wearing an underwire bra or putting on a deodorant can cause breast cancer. The answer is there's absolute rubbish, and there is no evidence to that fact. Now, can pregnancy prevent breast cancer? The answer is pregnancy cannot prevent breast cancer, but it helps to detect, in pregnant women, the breasts are generally lumpy, and it's very difficult to examine the breasts. And women should be particularly careful, particularly during pregnancy, because the breasts are generally lumpy and it's very difficult to pick up one lump within that. So any new change, even during pregnancy, other than the general lumpiness, they must report to a doctor. Can breastfeeding prevent breast cancer? The answer is breastfeeding cannot prevent, but it reduces significantly the the risk of getting breast cancer. And now coming to an important component of my presentation, the last component, which is lot of women ask me the question, doctor, you tell us to go and get a mammogram done once every year from the age of 40. So the standard recommendation for screening is once every year from the age of 40. Why are you asking us to get a mammogram done when I can't even feel a lump in the breast? Is it not too much to do? Now, what we need to be aware is there are not many cancers where you can pick up cancer in very, underline the word, very early stage. That is, before the lady or the doctor can feel it. Now, if you look at stomach cancer, colon cancer, pancreatic cancer, lung cancer, you can't pick up cancer early through screening, even ovarian cancer. But you can pick up breast cancer, cervical cancer, and oral cancer very, very early. So early that before the lady can pick it up, many years, 3, 4, 5 years. And when we pick up a cancer so small, we can say that with effective treatment, we can cure that person. We expect such a person to succumb to old age and not cancer at all. And that is why one of the main reasons I'm here talking to you about breast screening. Now, breast screening was introduced a number of decades ago, and there is ample evidence from published literature that annual screening mammogram for women over the age of 40 saves scores of lives. And therefore, it is very important to emphasize that early detection is the only way to fight breast cancer. In fact, there are 2 ways to fight breast cancer. One is breast awareness. Any new change which I have just mentioned must be reported to a doctor without delay. The second is women over 40 must get themselves a screening mammogram at least once in 2 years. I'm using the word at least, but getting it done every year is ideal so that we can pick up a cancer very, very small. When we pick up a cancer very, very small, we don't need to remove the breast. And in this day and age of what is called oncoplastic surgery, what is oncoplastic surgery? Combining oncological principles with plastic surgical principles, it is possible to reshape the breast. I'm not talking about reshaping the breast mound after removing the breast for cancer, which is called mastectomy. No, I am talking about a lumpectomy where a lump is removed in the breast. As a consequence of this lump removal, there is a defect in the breast. When there is a defect in that breast, when you leave a defect in that breast to that lady for the rest of her life, it is a huge embarrassment and a psychological issue because there is a defect. So this oncoplastic techniques help to reshape the breast to a near normal shape so that the lady cannot feel the defect or see a defect when she looks into the mirror. That is the latest advancement in the breast surgery that has evolved over the last 20 years. Just as there is a technique where we don't need to remove all the lymph nodes for breast cancer, which is called sentinel node biopsy, where we remove only a few nodes when cancer is early. Similarly, you can remove a lump and reshape the breast. The other point to mention is with the advances in medicine and science, previously, when there was a cancer which was fairly large, that is over 4 centimeters, people would definitely advise a mastectomy, which is removal of the breast, but not necessarily so now. In this day and age, one can reduce the size of the tumor by giving chemotherapy, which is a medication, a cocktail of chemotherapy prior to surgery to shrink the tumor. And after the tumor has shrunk, we are able to still conserve the breast. I'm not saying that it is possible to conserve the breast in all patients presenting with breast cancer. There will be some patients when the lump is particularly very close to the nipple or it is multi-centric, that is, it is involving more than one quadrant. It is necessary to remove the breast. And even when that breast is removed, it is possible to reconstruct the breast with a tissue or a flap that is brought from the abdomen or from the back to recreate a breast mound. So there are two different issues here. One is oncoplastic breast conserving surgery, where we reshape the breast after a lumpectomy. The other is reshaping the breast after a mastectomy with tissue from abdomen or elsewhere. The final component is to mention to you that a lot of times there is another myth that people who have breast cancer, they think that removal of the breast or mastectomy is superior to a lumpectomy in terms of survival. The answer is it is absolutely not at all correct, because a lot of evidence has shown that those women who have a lumpectomy followed by radiotherapy have equivalent survival to those who have had a mastectomy. But those who have had a lumpectomy must have radiotherapy to qualify this statement. And what I wish I had the slides again to show you. In the month of October, the foundation illuminates various monuments and buildings in Hyderabad in pink, which we have been doing for the past 15 years. Not one, not two, not three, not four, but several monuments. I wish I could show you the Charminar, the Buddha statue, the Prasad's IMAX, and this year we illuminated the Durgam Charvu cable bridge, we illuminated the T-Hub, we illuminated the Rabindra Bharati, and for the last 4 years, we have been illuminating the Raj Bhavan, the only Raj Bhavan in the country that turns pink for breast cancer awareness. And finally, I'd like to say that because counseling is not given due importance in our medical system and doctors don't find that it is important, the foundation has been inspired by Prime Minister of India's Digital India campaign, and we brought out a mobile app which is called ABCs of Breast Health. I repeat, ABCs of Breast Health, which is freely downloadable in both Google Play Store and App Store. It has got information about every aspect of breast health, which has been explained in simple, easy to understand format. And it is there not only in English, but in 11 commonly spoken languages. And that is why it is the world's first mobile app on breast health, which was launched by Amitabh Bachchan 6 years ago. And talking about Amitabh Bachchan, a few days ago, he celebrated his 81st birthday. And I was pleasantly surprised that those of you who watched the KBC show, the Kaun Banega Crorepati show, in December of last year, a slide was put up, a question where the celebrities who were invited for that show were Kajol and Revati, who had to answer the question, in which city do monuments get illuminated in pink for what disease? Breast cancer, tuberculosis, whatever. And I was so pleasantly surprised to get that. And that shows the impact that the foundation has created in making that much needed awareness about breast health. And so finally, ladies and gentlemen, I would like to apologize very sincerely for the fault. I don't know what fault. It has never happened to me before. From my side, it must be that the slides have not, not functional. And I wish you could see the visual presentation as I was speaking. But if there are two take-home messages, the first one is, as we cannot prevent breast cancer, it is important for all women of all ages to be breast aware. Any new change like a painless lump, recent retraction of the nipple, blood-stained discharge from the nipple, eczema around the nipple areolar region, or dimpling of the skin overlying the breast, please don't ignore. You must go to a specialist. And when you go to a specialist, if the specialist does not do the triple assessment and says to you that we should do an operation to decide, then you know that you're in the wrong place. Third thing is, women from 40 years must have an annual screening mammogram. This is the month of festivals. This is Dashara is coming up. Deepavali is coming up. To the men watching this, it is important that the women in your lives are, for all of us, the woman is the nerve center for the family. If she is well, all of us will be well. And therefore, instead of gifting a sari or in addition to gifting a sari, if you gift your spouse, your mother, your grandmother, your aunt a screening mammogram, if they're 40 and over, many, many scores of lives would be saved through early detection. My heart beats for early detection, and that's why I'm here. And I'm very grateful to the Rotary Club of Burdwan South and to the everyone, to all the Rotarians who have joined in this awareness program. Thank you very much. And I'm very happy to take any questions.
Thanks a lot, sir. Thanks a lot. It was really very good. ABCs of breast health, demystifying the myths. Hope the listeners would remember whatever you said. They will spread the message to their friends, relatives, to their better half. And we are really fortunate that we could listen to you sitting far away from your place. And we thank you very much for giving us your valuable time. Maybe it would have been better if the visuals were there, but whatever we got by the blessings of God, it was really enriching, sir. Thank you so much.
I will also
So-
I will also send a PDF file of the common myths and facts. I'll send an email so that can be circulated.
Yeah, this will be
Thank you, sir.
definitely helpful, sir. Can I speak a word,
Please.
Shobhanaji?
Yes,
Myself,
please.
Rotarian Samta Golcha, Women Empowerment Chair for District 3240 this year. So definitely for women's, this is the program dedicated for women's. And as today, I came to know that it is also, it can be also in men. तो कई चीजें ऐसे मिथ है कि जो चीजें हमें नहीं पता होती है इस तरह के सेमिनार्स और वेबिनार्स के थ्रू हमें मालूम पड़ती है, तो उसके लिए बहुत बहुत शुक्रिया सर। एक और चीज, एक मिथ लोग बोलते हैं कि यदि मेमोग्राफी कराते हो तो ब्रेस्ट कैंसर का चांसेस बहुत ज्यादा हो जाते हैं, ये मैंने सुना है, तो इस पे आपका कुछ कहना है तो?
बहुत सही है. Actually, this is a good point you brought up, ma'am. So a lot of times people think that doing a mammogram or doing a biopsy of the lump, needle biopsy, will spread the cancer. And that's the biggest myth. And there is absolutely no truth in it. Mammogram helps to pick up cancer early, and it doesn't cause any radiation, nor does it cause pain if it is done properly. And the least of all, it will not spread any cancer.
Thank you so much. Like it was, I have heard this among people around me that when it is pressed, so it causes.
Yes.
Thank you for enlightening
And-
us.
Thank you, Samtaji, and thank you, sir. May I ask, may I request anybody of the listeners, if you want to please raise any question, sir is ready to answer your query. Please go ahead.
Thank you very much, Doctor, and also to the Rotary Club for arranging a very enlightening presentation. I am Namaskar. I'm Kalpana Count, and I am from Dibrugarh in Assam in Northeast India. And I would also like to know, the fact that your mother is the chair of the foundation which you have. It's so inspiring that at the age of 90, she heads the foundation. And I would also like to know whether your activities extend beyond Hyderabad.
Of course.
Whether you go over to other states. Yes.
In the sense, the main aim of the foundation is to create awareness. And we've also implemented a large-scale screening program by way of clinical breast examination, where we trained healthcare workers in Telangana and Andhra Pradesh. And we screened close to 200,000 underprivileged people spread across 4,000 villages in the region. And this program, clinical breast examination-based screening program, after I wrote to the Prime Minister, this is now, to cut a long story short, this has been incorporated into the national screening program, where through the National Health Mission, clinical breast examination-based screening is clubbed with the oral cancer and cervical cancer screening program. Yes, we do programs outside. So, I mean, in terms of creating awareness, yes, I'm happy to come anywhere and then, offer my services. But in terms of, training people to perform clinical breast examination, that is another area that we are happy to do.
Okay. So, when a person goes from some other state, for instance, the training program will be for how many days?
We don't have a training program as such. We train the healthcare workers who are working with the government of Telangana and Andhra Pradesh between 2012 to 2016. And we are going to be commencing the next round of training, because what we realized is, although it is part of the National Health Missions program, screening program, it is not uniformly done in most of the states. In fact, in many states, it's not even being done at all. So there is no set way. I mean, we just spend a day with the healthcare workers to train them, educate them about breast health issues. They should know what various breast health issues are. We train them how to examine the breasts. That's it. And then they have to implement it locally. But without the government support, it's very difficult to do it.
Right. Yes, definitely. And the government has a huge network.
Yes.
But there are so many priorities. So breast cancer naturally, not be one of the priorities. And thank you so much. I mean, it didn't make a difference, whether you had the presentation or you didn't have a presentation.
I'm sorry, once again. Yeah.
I mean, it was with rapt attention that we heard, and I came to know about it only pretty late in the evening. But I'm sure that next time, the benefit of your knowledge and what you have been doing should be, shared amongst many more people. Thank you so much, Doctor. Nice to have you.
Yeah, thank you. Thank you.
I have one question.
Yes, ma'am.
Good evening. I am from Rotary Club of Siliguri Uttarayan Believers, and I am a chartered president and right now in publication member. Sir, I want to know that everyone is telling to take the cervical cancer vaccine. Sir, is it we should take it?
Well, yes, it's a good thought.
So what age we can take this vaccine?
Yeah. So first and foremost, there's no vaccine for breast cancer. But
no,
yes,
the cervical cancer.
Yeah. So for cervical cancer, there is a vaccine which protects to a large extent, not completely. But that vaccine efficacy is when someone is in teenage, under 20 years, before they get married, so that the efficacy of that vaccine is the highest. And to know more about this vaccine, you must consult a gynecologist. The best time to get the vaccine is during teenage time. Although people who are a little older also can take it, but the efficacy comes down beyond a certain age.
Okay, sir. Thank you very much, sir.
So, any more questions from the audience?
Hello, good evening. This is Rotarian Dr. Chitra from Rotary Club of Smart Hyderabad. I'm sorry I joined a bit late, but we have a donation by some of the Rotary clubs for the cancer screening bus. And MNJ Cancer Institute is doing it free of cost. They're going to the tribal areas, and we have a lot of ASHA network, and their government is supporting them, and then we are able to pick up. So that is one information I just wanted to share with you.
Yes.
Yeah, because sir said it's a huge thing. Government involvement is required.
Very true. I appreciate the efforts of those who are running the mobile screening through a bus. But experience, I can say that in a country like India, where 70% live in rural areas, only 30% live in cities, with very poor facilities of mammography and radiographers and radiologists who can pick up small, tiny cancers. It's not just doing the mammogram. It's the ability of the radiologist to be able to pick up small, subtle changes. There are very few in the country who can do that. With all these constraints, although to all the audience here, I'm emphasizing about opportunistic screening. We call this opportunistic screening when someone goes themselves and pay for a service and get it done. Unlike in the UK, NHS, where it is done once in 3 years, free of cost. And in America, you've got insurance-based schemes. Whereas in India, most of it is out of pocket. You have to pay for yourself. But in a large setting of screening, when you're talking about screening or a screening bus, where you go into the masses, when you go into rural areas and do it, the mammogram can only screen that many number of people in a day. And that requires a lot of expertise. It is possible to miss cancers as well. But clinical breast examination has been established through several studies, including the most recent study that was published in the Journal of Cancer in the, I'm not sure about, I think it's New England Journal of Medicine by the Tata Group. In fact, it is the largest study that has been done in the world, which has shown beyond doubt that women, particularly in underprivileged women who don't have access to this opportunistic screening mammogram, if they get the clinical breast examination done, that is the second best way. It is finding an Indian solution to an Indian problem. Whereas with mammography or mobile mammography, you can only do limited. With clinical breast examination, you can screen a large number of people at a fraction of very little time. And these are all trained healthcare workers that are already existing within the healthcare system that can be effectively utilized. In fact, this has been commenced through the National Health Mission, but sadly has not taken off because of various reasons in every state. But whatever it is, I think screening is what saves lives.
Yeah, but here one thing, M&J Cancer Institute, it's a government institute. They have dedicated all medical doctors specifically for the screening. So in a way, and the bus is has the latest, ultrasound mission, everything inclusive in that, and dedicated doctors go and do it. So that's maybe some advantage, as you said.
Yes.
In having a clinical person, gynecologist over there.
Absolutely. Absolutely.
Thank you so much. Where are you from, doctor? I'm sorry, I came late.
Hyderabad.
Oh, you are from Hyderabad. Oh.
I'm at KIMS Hospital, and
KIMS, okay.
I've established the country's first dedicated freestanding purpose-built center at KIMS Hospitals.
Oh, that's cool.
16
That's
years.
nice. Thank you.
Rotary in Shabarna. Shabarna.
Recently,
Hello.
I think Shabarno
Yeah,
is not
yeah,
around,
yeah.
but may I chip in?
Hello.
Shubhranko. I'm
Hello.
Shubhranko chipping in. Well, I think now it's time for a vote of thanks. And may I request our past president, past assistant governor, Pallavi Maji. Dr. Pallavi Maji is a pathologist, to introduce to Dr. Raghuram. Well, Dr. Pallavi Maji, can you come up with the vote of thanks?
Yeah. Thank you, sir. Good evening once again. This is indeed a privilege to propose a vote of thanks to this distinguished web gathering. At first, I should thank Dr. Raghuram Pillari Sethi for his wonderful deliberation. It is truly demystifying the common myths and was enough good to clear many misconceptions we have and to understand our health better and wisely. I also thank DG RID 3240, Rotarian Nilesh Agarwal ji, for his initiative to have this awareness webinar. Thank you, sir. I thank Rotarian Dr. Shubhranko Chakraborty, who was instrumental in inviting Dr. Raghuram, and it was his idea to have this excellent awareness webinar. I thank Chair District Women Empowerment Rotary and Samta Golcha from RC Guwahati Lewis for her thoughtful inputs. I thank Rotary and Shabarna President and his team, RC Bardwan South, without whom the webinar wouldn't have been successful. Finally, I thank the august audience for their participation, interaction, and patient hearing. Thank you very much.
Thank you. I take leave. Thank you.
Just
Thank you, sir.
wanted to
Thank you.
share one thing.
It is
Yeah.
like we never understood you were going without thing.
The PPT.
No,
Yeah,
like I
Thank
got so
exactly.
engrossed. It was like picture to me. I'll tell you frankly,
Thank you. Thank you very much. That's
and it was so much simplified. Like being a doctor, it was very simple to me. But I understood if you put it to some classic student also, the girl will understand what you are saying.
I was able to understand Pallavi Deep.
And
So,
we will love to have you again, sir, in physical
surely,
seminar too.
of course, surely. And I have many
I
friends.
hope, sir, you will respond to our invite.
I will. I'm very fond of West Bengal, and I've been to Calcutta many times. I have many friends there. And certainly I will come, and I feel greatly relieved that, the lack of slides did not, impair the understanding of this session. And I'm so
Don't be upset with your slides, sir. You are enough for that. Your speech was enough.
just wanted to share one thing with everyone. That as you said, the screening will help. Recently, we had one camp, which was with the mobile van, and we feel good. It was in the rural village, and we feel good when we are able to see the patients. 5 patients were screened for breast cancer and 3 for cervical cancer. So if they were detected in the early stage, so definitely it will be helpful for them. And then later on, they will be taken care in the hospitals in Guwahati. So thank you so much, sir, for your interest.
Bye-bye.
Namaskar.
Bye-bye, sir. Bye-bye. Thank you. Good night.
Subarnadeep, thank you so much.
So
Yeah,
it was good.
it
We
was great.
expected more audience actually. It reached to, I think, 51 or 52 at most.
Yes.
But I hope that it would be touching 70, 80. Somehow, maybe the festive season is going on. So a lot of people are busy for shopping, particularly in this part of Bengal. But
Basically, Navratra is also there.
It was interested. People all attended. Don't be upset about it.
No.
It was great.
I'm always encouraged.
But it was very one thing was undesirable because 600 women Rotarians are there. We expected a little bit of more participation, isn't it, Samta?
Yes,
Like,
yes, definitely.
600 members, yeah. So
I have
but
basically
it was
called.
like whoever were interested are there. So this is the best part of the webinar.
And Pallavidi, we can share this recording to different groups, even if people haven't
You asked
attended
Danny.
today.
I think Danny has.
Yes, yeah, it is. So we can just share in different groups so that at least people can go through it and at least gain the knowledge about this. Good evening, Kalpana Di.
I think there, I'm Shubhranko, chipping in again.
Yeah, sir.
I think we have an app of the district now,
Yes.
where clubs are supposed to upload their projects. Very few clubs I have followed do it sincerely and systematically. Almost all, very few of the clubs, they really upload their projects. But if this video or this lecture portion edited can be uploaded in the district app, that will be helpful for many lady Rotarians to go through and have some idea of what they need to know.
Yes.
Denida already has shared the link. Yes.
Yeah.
So the
Thank
video
you,
is already.
Danny.
Good evening, Minu.
Very prompt. Thank you so much. For those
Thank you, past district governor. It was our pleasure to see you there. It's always a pleasure to see you in the ma'am.
Danko had called me, but
yeah.
But I had some issues. My brother is very unwell, So, but anyway, I joined, because this has to be supported, any effort to
Yeah.
create awareness, right?